I'm in good hands.
Hello, my name is Vlad. I'm a nurse practitioner student. I'll be doing your exam today. Please tell me, what is your name?
My name's Becky.
Awesome, Becky. Welcome. Nice meeting you. Can you tell me, please, what are you here for?
I'm here because I've been having, like belching and burping up liquid and just kind of burning in my upper abdomen area.
Okay. And tell me, please, when did it start?
It was after having a meal at a restaurant that we went out for fish and chips.
Okay. Okay. And how long ago was that?
That was about 3 days ago.
3 days ago? Okay. So you've been having this abdominal discomfort and pain. Okay, can you point to where is it located approximately?
It's in the upper, but kind of more to the right.
Okay, okay.
More,
And anything that makes it worse?
Bending over,
Okay.
and if I eat too much of anything.
Okay. And can you please tell me what makes it better?
So I've been trying to just stick with clear liquids and smaller amounts, and it's helped it level off.
And can you tell me the quantity quantity of this pain? Quantity meaning 0 to 10 on the pain level. How severe is this pain or discomfort?
It pretty much maxes out at 7 to 10 or 7 to 8 out of 10.
Okay.
But last night it was like a 10 out of 10, so that's why I knew I had to come in today because I didn't go to the ER last night.
Okay. And did you eat anything different last night to set it off by any chance, or what did you eat yesterday for something?
Let's see. I think I had a milkshake because I just wanted something liquid, but I wanted something with some
A
calories.
little bit nutritional? Sure,
Yeah.
sure, I understand. So supper, you had a milkshake, and that really set it off. I understand. And can you describe the quality of this discomfort when it occurs? Is it achy? Is it sharp, dull? Is it stabbing? Throbbing? How would you describe the quality?
It's kind of a squeezing, and just like there's a tight belt around my chest.
And does it radiate anywhere?
Just under my right breastbone, but it doesn't radiate to like my lower abdomen or my right or left.
Have you noticed any radiation to the back by any chance?
It does not radiate there.
Okay, so just in the upper abdomen and on the right side a little bit, but no radiation. Okay. And okay, I understand. Severity we talked about. And can you tell me anything else associated with this? Have you been having diarrhea or vomiting?
No.
Okay, and have you been nauseous?
Maybe a little queasy, but no, not really nauseated.
Slightly nauseated. Okay. And how would you? What's your understanding of this? What do you think is going on?
I'm wondering if I got food poisoning from that restaurant.
Okay. Have you ever had food poisoning in the past?
No, but I've had kind of the heartburn part of this.
I see. Okay. And what have you tried? What helped to make it better? Have you tried anything for?
I haven't.
Okay.
I was just trying to, other than just, switching to clear liquids, I just was trying
so
to
that you tried
try
that.
it out.
Okay, but no medications. You haven't tried anything over the counter. Okay, I understand. I'll talk next about your various systems. Okay. And we'll ask you a few things. Have you had any fever?
No.
Fatigue?
Yeah, I'm kind of feeling
A little bit less energy than usual. Okay. Have you had any night sweats?
No.
Any weight loss or weight gain?
No.
Okay. And have you noticed? We'll talk about the skin next. Have you noticed any rash or any warm area of the skin, or any changes in the veins or molds, or any changes in the skin
No.
that you've noticed? No. Okay. And for your heart, have you noticed any palpitations or skipping beats, or any shortness of breath when you lie down?
No, it's as regular as a clock.
Okay, so your heart is doing well. Very good, thank you. You typically don't feel your heart when it's working? Very good, that's a good sign. And how about your lungs? Any cough, any shortness of breath, or
No cough.
no cough? Okay.
Yeah.
Have you been waking up with shortness of breath and like needing to catch your breath by any chance?
No.
No? Okay, very good. We talked about the abdomen already, so you denied nausea, vomiting, correct?
Mhm.
You had a little bit of nausea, but no vomiting, and no diarrhea, correct?
Yeah.
Okay, very good. And how about change in stools, as far as color, maybe dark stools, tarry stools, or harder stools, looser stools?
It's they become kind of more pale, yellow,
Okay.
and sometimes it's a little bit urgent.
Okay. But how many stools a day do you have, or how often do you go to the bathroom?
Normally it's once a day.
Okay.
It's a little bit less because I'm not eating as much
Okay.
over the last 3 days or so.
Thank you. And let's talk about your bladder a little bit and your genitourinary. Have you had any burning? You avoid well, no
Yeah.
problem in the department?
No,
Okay.
no problem.
And have you noticed any flank pain on the side, either on the right or on the left side?
No.
Okay. Very good. All right. Awesome. Let's talk about your medications. Can you please tell me what medications you're on?
I am on levothyroxine,
Okay.
112 micrograms daily,
Okay. Anything else?
and lorazepam, 0.5 milligrams, Q6.
Okay. And have you, for how long you've been on lorazepam for?
Probably the last 5 years or so, because
Okay. And does it help?
yes,
Okay. And do you take anything herbal?
no,
Are you allergic to any medications?
no.
No allergies? Okay. Very well. Okay, we'll talk about your past medical history now, okay?
Okay.
So I presume you're taking levothyroxine. You have a history of hypothyroidism?
Yes.
Is that true? Okay. And anything else besides hypothyroidism? Anything else in your medical history?
Well, I've had a couple bouts of diverticulitis.
Okay, you had diverticulitis. Okay, that's good to know. And you've been also diagnosed with anxiety in the past because
Yes.
you're taking lorazepam. Is that correct?
Yes.
Any depression in the past?
No, just more anxiety and stress.
Okay. And okay, we'll get to stress in a moment. But negative for depression. Okay. And have you diverticulitis? Have you ever had a colonoscopy?
Yes.
Okay. How long ago was that?
I think about 5 years ago.
And did they say to follow up at some point, or
Yes, 5 years.
so you're approaching
Yeah,
that mark?
Right
Okay.
around there, yeah.
Okay. All right. So it was then pretty normal study, correct? And in
Well,
the past,
they did get some polyps.
polyps. You had polyps removed.
Yeah.
Okay, but they were probably benign, so that's good. So polypectomy. And how about in the past? Have you had any cancer in the past?
No.
Either GI or kidney, or how about any gastroesophageal reflux disease? Any
No.
no?
Yeah,
Indigestion
just
or
heartburn.
GERD?
Just
Heartburn. You
yeah.
had some in the past.
Yeah.
Okay. And how about any gallbladder issues, cholecystitis,
Mm-mm.
Any biliary or any liver problems?
Mm-mm.
No. Any pancreas issues? Pancreatitis, hepatitis? No.
No.
Or any female organ cancers or any issues with fibroids or anything like that?
No.
Okay, very good. And have you had a hysterectomy?
No.
So all your organs are. Have you ever had surgery?
Yes.
What kind of surgery?
I had my gallbladder taken out.
Hysterectomy negative, and so you had the cholecystectomy.
Mhm.
Okay. Okay, got it. Very good. Let's talk about your diet a little bit. What did you have? What did you have for breakfast today, please?
I had a Jimmy Dean breakfast sandwich.
Okay. And is that your usual? Do you have a sandwich for breakfast typically?
That or I'll just maybe have an omelet with ham in it.
Okay. And do you consider yourself healthy eater?
Yeah, I probably eat out, not very much, so that's good.
Well, what does that mean? Once a day you eat out, or
No, probably only once or twice a month.
1 to 2 times per month? Okay. So fast food, is that fast food?
Sometimes.
Okay. And have you had any travel recently? Did you go out of state or camping or out of country? Overseas?
No, I haven't. I'm a primary caregiver for my husband who has dementia.
Oh, okay. So your occupation, but you're technically retired right now,
Mhm.
but you're a caregiver for your husband.
Yes.
Okay. Okay, that must be stressful. I'm so sorry. How advanced is his dementia?
I have to make sure he doesn't wander out of the house.
Okay, so it's probably pretty advanced if he's at that level.
Yeah.
So that must be stressful for you. I'm sorry. It's hard work. And do you have any respite care? Do you have anybody else coming in to help you out, like at night, to get a good sleep and so on, or you're
No,
24/7?
it's just me.
Okay, all right. So we'll talk about that and address that.
Okay.
Do you get any exercise, or do you walk, or do you do anything for exercise?
Other than, walk around the house or out in the yard, no.
Okay. And do you use any alcohol?
Yeah, I'll have maybe a glass of wine with dinner at night.
Okay. And does it happen every night? You have a glass of wine?
Yeah, probably six to 7 times a week. Yeah.
Okay. All right. And do you smoke?
No.
And have you ever smoked?
No.
Okay. Very good. Thank you. And have you ever used illicit drugs?
I have not.
Cocaine, marijuana? No? Okay. Thank you. Let's talk about your family history. Let's talk about your mom.
Okay.
What does has your mother had any GI issues, any cancer or any congenital anomalies, or stomach cancer, for instance, or any issues with mother's health?
No, she just has macular degeneration.
Macular degeneration. Your mom is still alive?
Yes.
Okay,
I
very
don't
good.
know what ANW in assisted living means.
Okay.
Oh.
Okay, so that's good. So your mom is alive and well. Very good. Macular degeneration. Thank you.
Yes.
And anything else with mother's health?
No.
No? How about your father? Is your father still alive?
No, my father had stomach cancer and he passed when he was 56. So
Oh, wow. Okay.
younger than me.
Yeah. So that's scary. So stomach cancer. Okay. And do you have any siblings?
They're all well.
Okay. How many brothers, sisters do you have?
3.
Okay. Older, younger than you?
2 younger and 1 older.
Okay, so 1 older. Thank you. And do you have any children?
I do not.
Okay. And in your family, do you have any autoimmune disorders by any chance? Any Crohn's disease? any cystic fibrosis, any again cancers besides your stomach cancer and your dad. Nothing else.
No.
Okay. All right. Thank you. All right. Well, let me do a physical exam here next, and we will proceed from there. Okay.
Yes.
I will look at your mouth real quick. Okay. Because you've been having this burping and stuff. Can you open your mouth for me and can you say ah? Okay, I'm examining her pharynx and her. You can go ahead and relax and just show me your cheeks. I'm looking at her buccal mucosa. Can you bring your tongue up, please? Okay, I'm looking for any presence of ulcerations or geographic tongue,
What are you looking
frenulum.
for in the oral pharynx?
So oral pharynx, I'm looking. I'm just looking for any presence of like cobblestones or cobblestones. Like if there is any irritation from acid coming up. So I'm looking at that, and to get a better picture, I would need
But that's
speculum, but
because he actually can see that.
yeah, I was. That's what I was gearing for, and I also pay attention to her looking at the pharynx as well.
It also says fetid breath.
Fetid breath, yes,
Oh, okay.
which I probably have right now. From stressing out. Okay, so that looks good. I will feel for your neck a little bit here. Okay, there's no fringe or good enough. Okay, that's good. I would like to listen to your heart and lungs.
Okay.
And so when pain starts over here, right? And you said it goes over here a little bit.
Yeah.
You feel it
like-
here also.
Yeah. Yeah.
And then it goes up as well. When you birch, does it go up?
Yeah.
Do
There's
you
a
feel?
little bit of burning up in there.
And when I press slightly like so, do you feel any difference?
Not really.
Not right now.
Yeah.
Okay. Thank you. Okay, I'll listen to your heart and lungs. So first I'll listen to your aortic area. Okay. Thank you. Good. Okay, let's listen to your back, please. So start on the bottom and through your mouth, please. Take a deep breath in and out. Very nice. You don't have to hurry. Take it easy. Take your time. Very good. Okay, your lungs are clear. That's good. You can listen to your right side here a bit. You can relax your arm. You're fine. Okay. Deep breath for me again. And this is your right middle quadrant. And we'll listen to your interior lung field. Thank you very much. Your lungs are clear. And you haven't had any shortness of breath, and your breathing has been pretty good. Okay, excellent. No cough. You said and so on, right? Okay, very good. Okay, I will listen to your tummy next. Go ahead and swing your legs in and do any assistance. Are you good?
Yep.
Alright, let me double your pillow. That will make it a little bit more comfortable for you. Okay? There you go. And go ahead and bend your knees. I'd like you to have your tummy totally relaxed, okay? That will help us with that. Now we'll take a peek at your tummy. Oh, you have a little spot here. What is that? That's your colon. Wow. You were telling me the truth. Very good. Okay, I'm looking at the venous patterns. Notice the scar here from cholecystectomy. So you had an open cholecystectomy, huh? Because of the scar, right? Did you have an attack and it had to be done urgently, or it
No,
was
I
scheduled?
was in denial.
Oh, I see. All right. So I'm looking for symmetry for venous and non-venous patterns. I'm looking for ascites. And I don't see any of that. I will listen to, so I inspect first, then we auscultate, and then we'll palpate for cosmic pulse. So, sorry for a cold fever. Okay, both tones are good. Present and normal. Okay, very good. When was your last bowel movement, by the way?
A couple hours ago.
Okay, so that's good. I will pick us next, okay? So you'll feel just more looseness. I'm going to go a little bit higher if you want to listen through your tummy. Hold your shirt from me just early. Thank you so much. Okay. Thanks. Yeah, so you can have it. Okay, so I'm listening for timpani or any fluid or something abnormal, and I hear dullness throughout, except for over the desk level. So that's normal. I will lightly palpate your tongue next, okay? Just with one hand. You let me know if any tenderness you might be, okay? Or you may feel so over here, okay? This is where your stomach is, right here. So that's where your a little lightly over your neck regions of the tongue. Now we'll go a little bit deeper. So I'm feeling for any enlargement of your organs. Okay? And I feel normal stool in your colon. And it's normal. Your bladder rates, I felt it tense up a little bit. You will have some urine in there. Okay, that's good. So no tenderness on the lower abdomen. Okay, very good. I will feel for your liver next. Okay. Okay. Okay, taking a deep breath for me, please. Okay, go ahead and relax. Oh. Very good.
Do you feel it?
And I don't. And I will feel for your spleen as well. Okay, again, deep breath and out. Okay, your spleen is normal, and that's normal not to feel it, so that's good. Okay, very well. Thank you very much. Let me listen to your bruise. I'd like to listen to your bruise in your the bell. And I will listen to your aortic. Aortic blood flow. Okay, that's good. And I don't feel any bruise there. And this is your renal artery. Okay, I don't hear any extra bruise there either. Okay, very good. Okay, you may go ahead and sit up, please. Here, I'll help you. Okay. I will feel for something without vertebral tenderness or on your side. Okay. Don't be afraid that it will you'll feel a little jolt. Okay. On your back. So okay, here we go. Did that cause any tenderness?
No.
Okay.
Like a sledgehammer.
Okay. No sledgehammer. Okay. I don't mean to hurt you. Just need to test. Okay, good. Because if you had trouble with your kidneys or with kidney stones, you would feel a lot discomfort in that area. So. Okay, very good. Very well. I think. Okay, so I think you may. So my diagnosis for her.
System above.
System above,
And
system,
what's the system
and system below. I did cardiovascular, so I did her, you know.
That's above. What's below? I'm giving you a clue.
Okay. Well, the aorta and arteries, that's below.
That's all abdomen. Okay, what's below the abdomen?
And you want to, we can also feel for her lymph nodes in the pelvic area, and also GU. So.
And what's
And also we could, I would do a BCR exam.
there you go. Okay, so tell me how you do in
So, on the woman, I think the simplest to do a rectal exam is either to have them lie on the side with the leg raised up a little bit to the side, and then I'll explain to the patient what I'm going to be doing. And so I wear gloves, probably double glove. I'm right-handed. The right hand.
That's important to be aware.
Yep, use a lubricant, a water-based lubricant. Have all the necessary equipment at the side. So we have a Y card with me because I want to test for fecal blood.
Right.
So I would do that. So you will feel me. You will feel my finger in your rectum. So I will inspect your rectum for any fissures, for skin discoloration, erythema, or irritation. I would check also note any skin tags, any warts, any abnormalities. And then I would explain that you will feel my finger going into your rectum right now. You can go ahead and relax and kind of bear down a little bit as I.
So this is
This is her rectum. So you will feel me touching your anus first, and so I'm just checking for anal tone. And sometimes you wink, and that's normally sucks. So you will feel me going into your rectum, and so I would go in gently like so.
And so what you want to do, and you said this, that you want to just touch, and she's gonna involuntarily tighten down.
Yeah.
And that's going to be a minute. It won't just be a wink. It's going to be a minute. So you leave it. You leave your finger there with a little bit of, just not that much, just a little bit, until you feel it relax, and then you go ahead. And then what do you
do? And then I check anal tone, and then I palpate. So this is her anterior and then lateral. So I feel around the sides and then posterior area of her.
Now your thumb's not going to be doing anything because this is all perineum. So you're just going around like this.
So feeling around, feeling around for, and then appreciating for any hemorrhoid, or loss of tone.
And mainly, what's the main thing you're doing? You already said. What's the main thing you're trying to get?
So I'm trying to get a little bit of stool.
There you go.
And of course, if there's like rectal masses, I will possibly.
And so this is probably how I do it. Is just exactly what you said. You inspect and you say, I'm going to touch now. And then you get that wink, and when she starts to relax, you say, I'm going to go ahead and go in. And then you just like that. Once you get it, you just do quick, and that's it. So it can be really quick.
And then just tissues and just wipe a little.
Yeah, it's nice to give her a few tissues. And then how long, when you put it on the guac, how long do you leave it on there?
It should be left for a few minutes, up to 5 minutes.
2, 3,
something like that.
But you don't put the fluid on right away. You gotta let it sit.
Sit and dry out a little bit. Yeah.
Okay, good.
So we'll test for that, and your guaiac is negative, so that's good. You don't have any hidden blood in your stool, so that's good. But still have that colonoscopy, okay? That does not exempt you from following through with your gastroenterologist. So my differential.
Well, let me give you a little feedback, and then you have a few minutes.
Okay, sounds good. Sounds good. Can I? I'll pause because.